Chronic pain is an issue that burdens many people daily. Medicine, physical therapy, and an expensive bill is what they're given, but the relief doesn't last. However, new advances in stem cell therapy allow people to find relief and keep it. I'd like to welcome you to Celebrate Michigan, a show produced on the campus of Madonna University. I'm Chris Benson, and today we're very pleased to have Kevin Lucas and Dr. Stephanie Tilley with New Hope Regeneration. Welcome to the show.
Thank you so much for having us today.
Tell us all about New Hope Regeneration and how you became involved with it.
Well, you know, knowing that people struggle with chronic challenges, whether it's pain or the body's ability to heal the way that it did in its 20s or 30s, really is a huge piece that people struggle with all over the country and really all over the world. And our goal is the restoration of relationships by helping people regenerate their bodies, because we know that the pain is a challenge, but it's the lack of things that a person gets to or doesn't get to do in their life that really causes them a lot of frustration and challenges and discomfort.
And Dr. Tilley, how did you come to be involved with this?
Well, Kevin brought me on board because they wanted to expand into doing treatments dentally. And so we started doing treatments in my office, and over the past 3 to 4 years, we have seen some great results from things that have been happening with patients.
Yeah, and I would even really take it another step further and say we've seen some spectacular changes happening, and we're really excited to talk about what those are today.
So tell us about stem cell therapy. What exactly are we looking at?
Yep, so a person's body's ability to heal, regenerate tissue, build tissue, its immune system function, all revolve around a person's stem cell bank account. And one of the things that happens as we get older in life is that we just have lesser stem cells. So imagine you had to have a big remodel project going on in your house, but as you got older, you didn't have the money needed to be able to rebuild your house. And that's kind of what happens to us physiologically. So we now live in an era where we have the ability to increase a person's stem cell bank account with regenerative therapy.
You make it sound so simple. I'm sure there's a lot of science behind this. And how exactly does that happen? If you had to, for a layperson like myself, I've heard stem cells in the news, but I really don't understand it that much. So
yeah. So the reality is that there's been a lot of conflicting and confusion and even information that people don't really understand. Mm-hmm. And quite frankly, stem cells are our body's natural internal repair system. And when we don't have enough of those cells, we struggle to be able to repair the things that we used to. And I like to tell people there was a time period where we didn't have electricity, and now we have electricity. And there was a time period where we couldn't increase a person's stem cell bank account, and now we're able to do that through a very simple either IV push or a very simple intra-articular injection or intramuscular injection.
So walk us through, like, if I was interested in this, let's say I have a condition, you mentioned chronic pain, maybe it's joint pain or something like that, or I'm really struggling with that. What would that involve if I were interested to come in and check it out?
Yeah, absolutely. So for people who are interested in being able to increase their body's ability to naturally repair, they would come into the office or they would call us, and our medical team would do a very simple evaluation and consultation. And then from there, they would just set up a time to come into our office and receive therapy. And this is one of the most amazing things, and I know Dr. Tilley can support this, is that the ease in which therapy is administered is really one of the simplest things that we've seen in all of healthcare.
Definitely.
So, and as it, you mentioned a consultation. Once I do that, is it a series of events or steps or visits? And how do I know what will be the plan for me?
Yeah, absolutely. So our medical team would talk with you about your unique situation. Mm-hmm. The beautiful part to this is that there's not anybody that doesn't qualify. This therapy is very, very safe. In fact, it can't hurt you. There's nothing that can happen from a negative capacity, unlike a lot of either surgical or pharmaceutical interventions where there can be a lot of very serious side effects from those dynamics. And so a person would talk with our medical team. They would discuss their unique situation on what they were looking for help with. The beautiful part is that because we're not curing or treating any disease or condition, all we're doing is improving a person's natural ability to heal. It makes it receivable so anybody can receive this life-changing therapy.
And how did you come to be connected with it, Kevin?
You know, that's a really great question. So for over 20 years, I specialized in working with a lot of severe neurological challenges and special needs children. And we realized we were in a spot where we were just helping people manage their decline. And it was kind of like putting duct tape on a car, hoping that it would hold together. And we were introduced to stem cell therapy about 6 years ago when it became available in the United States. And that's when I had contacted Dr. Tilley, wanting to translate it not only from general health and wellness but into the dental world, because there's a tremendous capacity for people's oral regeneration to happen in ways that we didn't ever believe was possible before.
Yes. And I know in the second segment, we'll talk a lot about the dental piece of it. You mentioned chronic pain. There's so many different conditions that people are finding out more about. And that science is really, you know, giving us more information about. What are some of the typical conditions of chronic pain that people might come to learn about this with?
You know, if you look at the CD9 code book, which is the diagnoses that can be given in this country, there's 139,000 different diagnoses that a person can be given.
Wow.
And so it becomes very complicated. And that's what's so powerful about regenerative therapy, is that it doesn't matter what that diagnosis is. We work with clients with everything from, you know, severe neurological challenges to people who are looking for anti-aging and just wanting to have better energy or improve their immune system dysfunction. We know that regenerative therapy focuses on three primary things: helping regenerate and rebuild tissues, helping to modulate the immune system or improve immune system function, and being able to decrease inflammation. And we know a diagnosis is either one or a combination of those three things. So if a person is struggling with degeneration, inflammation, or autoimmune challenges, they're a great candidate for regenerative therapy.
And I feel like you mentioned like the immune system and immunotherapy and immune compromise, and I feel like during the pandemic we've learned more and more about that, and that's become more to the forefront.
Yeah, absolutely. Yeah,
and I imagine that's a large population that would be interested in something like this.
Yeah, and we're just seeing even just general stress has such a dramatic impact on decreasing a person's immune system dysfunction. I mean, just look at what happens to students during finals week, right? We know we see a lot more colds and flus and bugs, not because they're any lesser than what they were, but they're stressed, so that really decreases a person's immune system function. And regenerative therapy has a tremendous ability, scientifically showing how this can drastically improve a person's immune system function.
Well, it sounds very exciting. I can't believe we're already at the first break, but we are there. So we're going to take just a quick break, and when we come back, you'll hear all more about this exciting new stem cell therapy. Stay tuned.
Family life in need of a slowdown?
Hello, I'm Dr. Spruce. Did you know all those green shapes on maps are parks and forests? It's true. Visit discovertheforest.org and plan to visit a park or forest near you, instead of just wondering what it would have been like.
While the word forest might make you think of distant lands from far, far away, please note parks and forests are closer than you think, which means things like beautiful scenery, fresh air, and family time are also closer than you think.
There's a lot of fear in coming back to school. I'm a 40-year-old man that walked in there to get his high school diploma. It was very hard for me, but one of the teachers was Miss Araceli. She gave me direction. Every single time I had a question, she'll put down whatever she's doing and she'll sit there with you until you get it. 50% of getting your high school diploma is walking through those doors. The other 50% is doing the work.
Find free adult education classes near you at finishyourdiploma.org.
So there you are, shuffling through a stack of resumes, and you come to mine. This is it, first impression, my way in. But can my resume show you how I truly stand out? Like that I was studying, going to night school while working 2 jobs just to help my parents pay for groceries. Or being the first one to always step up. No, that's something you just can't put on paper. Look beyond the resume and discover new ways to develop great talent that is dedicated, hardworking, and determined like me.
Maria, so how's work?
Doing
was fourth period biology. Our students just weren't getting how easily viruses spread. So Miss Bell and I had them role play a zombie virus outbreak. By the time they had all learned the lesson, all the living were dead. Hey, how's your job going?
That big sales meeting I planned? Next year, I might get to go.
Cool.
We are here on the set of Celebrate Michigan. I'm Chris Benson, and again with us, Kevin Lucas and Dr. Stephanie Tilley with New Hope Regeneration. We talked a little bit about dental stem cells. Let's talk about that further. How are stem cells involved in dentistry?
You know, this is one of the most exciting things, is that when we were looking to see how we can help a person's overall health and wellness, Dr. Tilley, can you just talk about what oral health has from an impact perspective on people's general health and wellness?
It starts the whole digestive system in our bodies, and people don't realize that. And a lot of times medical doctors, they haven't had much training on the oral cavity. And a lot of times we find secondary cancers in the mouth, and it starts the whole digestive process. And with that, we see a lot of inflammation going on, which means there's inflammation in other parts of the body, especially in your gut. So he and I got together and started discussing, you know, what could we do to help the inflammatory process in the oral cavity? And from there, we started working clinically on some patients, which we'll show you here in a moment, to show you how we have improved some of our patients' health.
Yeah, it's been really amazing because we know there can be a lot of cardiovascular challenges from infections in the dental cavity. And so when we first approached Dr. Tilley, you know, you get to meet a few people on the planet who genuinely have the ability to just change the scope of where a career or a profession is going, and that's who Dr. Tilley is, and that's why we wanted to bring her on board and helping develop the kind of the dental branch of what we call our organization, and doing regenerative therapy, but in the mouth.
And I think it's so exciting to hear you talk about that. It seems like just in my lifetime, remember in just recent years, hearing so much more about the importance of the health of the mouth, and how, again, there are so many, you mentioned cardiac issues, heart issues that can be involved in that. And you'd never connect those two, the common person would never connect those two things.
Right. Yeah, we really get stuck on thinking that there's a problem when we're in pain, but the reality is that, you know, an organ or even a tooth can be at 70% deterioration without any symptoms whatsoever. And so then a person comes in and they're like, I'm having all these problems, but it's so much more worse than what they were. And conventional healthcare before stem cell therapy really only offered the ability to kind of put Band-Aids on things. And now we truly have the capacity to help a person regenerate tissues in their body. And this is the most amazing thing about stem cell therapy, is that there's no limitation on the tissues that they can help rebuild and repair.
And it sounds so much so appealing to me, because when I'm one of those people who, when someone would diagnose or something and say, oh, here's a drug you can take, I'm not a big fan of that. I love this concept of regenerating from your own body. It just seems a lot more natural, and it seems like it's something that I could really get behind.
Well, when we first started doing regenerative therapy for the mouth, and we worked with our first batch of patients, and Dr. Tilley was, you know, taking the patients through the process, and they were regenerating, you know, periodontal tissue, or they were regenerating their gums, or people were not needing a root canal. That was pretty shocking and
significant
and life-changing.
Yes.
And so, can you just talk to, you know, what kind of an impact, you know, even just regenerating 1 millimeter of tissue in a mouth means significantly?
Well, what it means is that it allows the patient to have stabilization of, you know, where their oral cavity is going to be able to stay maintained, and they end up with severe periodontal disease, or they end up losing a tooth. And then we have some situations where we have what's called peri-implantitis, where we have very angry tissue around an implant. And not only does the implant start failing, there's very angry, bleedy gums, and it starts affecting the natural teeth that are around it as well. And by treating this, we have been able to really make a difference in some patients' lives.
And as we hear about, I'm sure, diseases like diabetes and conditions and those kind of things, that it's very difficult for people with that to maintain oral health, you know, and I can see that would lead, again, to other things.
Yeah, inflammation really is what's called the silent killer. A lot of people don't realize that, you know, we think about a broken bone, or we think about a cut in our skin as significant, but even just inflammatory processes on the vessels, you know, for the teeth or for the heart or for a finger are a significant part of the challenge. And so seeing people's bodies' ability to heal the way that it did 5 or 10 years ago is pretty life-changing.
And I understand you brought some pictures to share, so we're going to put those up on the screen and we're going to have you talk through what are we looking at here.
So this is a really great picture of just 2 stem cells dividing. One of the powerful dynamics about stem cells is that their ability to create more stem cells, and that's a challenge as we get older, is our own stem cells start to slow down in their ability to make more of themselves. But what science is showing us about umbilical cord stem cells is that their replication rate is tremendously fast and powerful, so that's why we see such a strong change there.
Interesting. Oh, and I see before and 6 weeks after. Wow.
Yes. We're trying to, this patient did not want to have this tooth removed unless absolutely necessary. So we did a stem cell treatment there, and as you can see, the bone is starting to stabilize and the inflammation is starting to go down.
And in that first picture, you can actually see a crack through the tooth up towards where the crown is. And in the second picture, 6 weeks later, that crack is actually starting to heal. Now, what's interesting about this is that this gentleman was on round after round of antibiotics, which have a tremendous negative side effect to a person's gastrointestinal health.
Sure.
So seeing our clients be able to not have to take as many medications, but as Dr. Tilley said, keep the tooth, that is life-changing. And what's so important about a tooth being able to stay in the mouth where it's supposed to go?
Well, the masticatory system is what starts our digestive system, so we need it to be able to, you know, maintain our health in general.
Absolutely. And if I can keep my teeth, that's a good goal.
Yes,
right?
it is.
It's a big deal.
And here, just another picture showing just the vast improvement.
Yes, you can see how angry it is on the left side.
Now, one of the most fascinating things that I didn't know, and Dr. Tilley is just such an advocate for people's, you know, health and wellness. In this first picture, it's a picture of an implant, and what was happening is that the bone was starting to erode away from the implant, so they were going to lose the implant. And 6 weeks after therapy, there was actually 3 millimeters of bone growth back up and around the implant. So the patient spent a ton of money for the implant. They were going to lose it because the bone was deteriorating, and that's not the case anymore.
My gosh. Well, this has been very interesting. And again, we've come to another break. Stay tuned. We'll be back with Kevin Lucas and Dr. Stephanie Tilley and more about New Hope Regeneration.
You realize that 49 million Americans struggle with hunger? That's 1 out of every 6 Americans.
These people are around us every day. They're our friends, they're our coworkers, their kids go to school with our kids.
Sometimes we're not even aware that they're struggling. This problem is closer than you think. So is the solution.
Play a role in ending hunger. Visit feedingamerica.org/hunger and find your local food bank.
Sounds like you could use some Van Gogurt. It's fortified with arts-rich nutrients to improve your math and reading skills. Catch!
Van Gogurt, thanks. So what's the deal with your ear?
Always with the ear, huh?
Feed your kids the arts. For 10 simple ways to learn how, visit AmericansForTheArts.org.
Hey, you.
Yeah, you. Getting that college education? What are you gonna do? Graduate and take some office job? Be like everybody else?
Or will you dare do something different?
Like, be a teacher. You could be my teacher. You got the skills.
The smarts?
Yes, you. You could be the teacher I never forget.
That'd be cool.
Does that corporate job even have recess? What are you gonna make of yourself?
What are you gonna make of me?
Mom, can I have $1?
Yeah, it's right. I think my purse is upstairs on the bed. Check the dining room.
No.
What about your sister's room?
Not there either.
The upstairs closet? The downstairs closet?
There are no more closets.
Moms everywhere are finding ways to keep kids active and healthy. Get ideas, get involved, get going at letsmove.gov.
Welcome back to the set of Celebrate Michigan. We're here today again with Kevin Lucas and Dr. Stephanie Tilley from New Hope Regeneration. And we were talking about stem cells, umbilical stem cells. And of course, you know, there are a lot of misconceptions and it can be controversial. So let's talk about that a little bit.
Yeah, first and foremost, we just want to clear that up. You know, when the doctors first started looking at stem cell therapy 60 and 70 years ago, they were taking the cells from embryos. And fast forward, you know, to today, we now know that that never has to happen and it really never should have been happening. So what we're seeing today is that the stem cells are oftentimes being, they're coming from umbilical cords. And so these are cells that would have normally been thrown away in the trash. They would have not been used. And we now know that these are the cells that are the most effective. And this is the highest concentration of where there's the most stem cells anywhere in a body. And so we're now able to use the cells that God used to build us to be able to help people rebuild and restore their bodies.
Isn't it amazing how we realize things that we either just threw away or took for granted, you know, now we're like, oh wow, those are valuable pieces to look at. Well, Dr. Tilley, I imagine that in your work, you get very personal with your patients and that you've seen lives changed. I wondered if you could just share a story or two about how patients have benefited from the work that you've done.
Well, yes, one that's dear to me is one about my sister. She had switched climates from Denver over to Tampa, Florida, and had been diagnosed with sinus polyps and was going to have to go in and have surgery, had been on antibiotics for about 8 months. And I said, well, come in and, you know, Kevin and I are going to do a treatment on you, you know, and see if we can get your sinus issues to go away. And so we treated her sinuses, and then she went back to her ENT 9 weeks later, and her polyps were gone, and all of her sinus issues had resolved, and she didn't have to have surgery. Now, as far as dental, I've had several patients that I have, they've had pulpitis, which is inflammation of the nerve, where usually we go in and do a root canal and remove the nerve tissue to get rid of the pain. And so in that case, they didn't really want a root canal, so I said, well, we can try to inject the actual nerve tissue and get rid of the pulpitis, which is inflammation. And so we injected into the nerve tissue and it resolved itself, and those patients did not have to have root canals.
And when you have, these are just wonderful stories, because when you have things going on with your sinuses or your mouth, it is just, quality of life is just depleted.
It's miserable.
And chronic pain
Truly
just can take the joy out of your day, for sure. And it's so wonderful that you've been able to see people who've benefited from that.
And it also helps with TMJ. We've had patients we've injected in that, and it's really decreased their pain that they've had in that region, increasing their range of opening. And with all the other work that Kevin has done in his, you know, prior career to this, he has seen huge improvements with that.
Yeah, I mean, we really just pinch ourselves every day because we're seeing things happening for people, and we're seeing people's bodies do things that we were told were impossible. You know, quite frankly, we were told for the longest time, you know, once a nerve is damaged, it can never repair, or once you have this happen, you can never get better. And what we love most hearing, what Dr. Tilley and I love most, is that when our clients call us or they send us text or emails saying, oh my gosh, I just got to go do this, or we got to, you know, go to our, you know, a kid's event, or we just went on a long motorcycle ride that I had to give up 10 years ago. It really, truly is life-changing beyond anything that we've ever seen, you know, in the past.
And I think, you know, you mentioned antibiotics is like one of the tools in our arsenal to fight, you know, some of the conditions that we have. And I think you hit the nail on the head. There's so many different conditions people have where antibiotics don't work for them, or the quality of life they have from taking antibiotics is so diminished that it just, again, is not solving the problem for them.
Yeah, and I want to be very clear and state that, you know, pharmaceuticals and surgery saved lives. My life was saved as a child. I had to have emergency surgery, and I wouldn't be here today without that. But we're also living in an era where people are struggling with chronic pain, and they're taking more medications than what they've ever taken. They're having more surgeries than what they've ever had. And that really has to change. And right now the FDA is saying that there's about $8 billion worth of surgeries done every year that don't really need to be done, but those were the common practices. That was the standard cookbook, so that's what they were used to doing. And now we don't have to do those things to the same degree anymore.
So more options, this sounds like
Yeah.
what you're looking for,
Yeah.
and helping people find the right option for them.
Yeah, really, really, truly, because we're not the same. You know, a 250-pound man and a 100-pound woman shouldn't be given the exact same protocol because their bodies are uniquely different. And even if they were the same height, same weight, how a person got there is very different. And the body is intelligently designed. And I like to tell people that, you know, you didn't have to go to the doctor's office when your mom and dad made you. The doctor didn't tell your body how to grow. God and your body knew what to do. And God and your body know how to repair things, and a lot of that has to do with your body's ability to have enough of the cells that repair what you need repaired.
What do you each see for the future for New Hope Regeneration? What are your hopes?
You know, my hope is that people just realize that they're not their diagnosis. We've done therapy for over 200,000 people over the last 6 years. And,
Say that again,
200,000 successful therapies with 0 side effects, 0 negative reactions, and nothing, all of the good and none of the bad. And so our goal is to just have people know that they are not their diagnosis, and your body is miraculously and wonderfully made, and there is hope for healing. And in the dental world, you know, we love being the forefront. We love being the point of the spear, and I love the fact that Dr. Tilley, you know, has dove headfirst into this and helping people around the nation know that this is available.
And tell us your website again. Where can people find out more information?
Yeah, they can go to newhoperegeneration.com, and we have some amazing resources on there that they can learn more about or schedule a complimentary consultation, and then come into the office and receive this life-changing therapy.
Well, we've really enjoyed having you. Thank you, Dr. Tilley, for sharing your enthusiasm for this work as well. We really appreciate having you here today.
Thank you so much.
And sadly, that's all the time we have, believe it or not. We will definitely see you next time on Celebrate Michigan, where we talk about all kinds of fascinating and interesting things that improve lives. That's what we're here for. So see you next time, and we hope you keep celebrating all the great things in the Michigan state. Thank you.